Hi, I'm Dr. Brittany Bryant, and I'm so glad that you were able to join me again. Today, I want to talk about both substance use and mental health disorders and why any of it even matters. So, we know that a lot of people are dealing with it. In fact, the National Survey on Drug Use and Health found that 1 in 5 adults, that's like 46.6 million adults in the U.S., have some type of mental health disorder, and 1 in 12 adults have some type of substance use disorder. That's about 18.7 million people. Now, here's the thing that a lot of people don't know. About 8.5 million people were found to have both a substance use and a mental health disorder. So that means that there are lots of people in the US that deal with both depression and alcoholism, or both anxiety and cannabis use disorder. You know, like smoking a little bit of Mary Jane. And so when we take a look at this, one of the questions that I always ask myself is, how does something like this happen? Well, let's think about it. Imagine if you're dealing with symptoms of depression and anxiety, but you don't know if you have a formal diagnosis of it, or there's a number of people who may think to themselves, you know what? I'm just gonna smoke a blunt, I'm gonna get high when I'm feeling anxious, when I'm feeling worried, or I'm worked up. I just need to calm my nerves down. Or I feel sad, I feel low. You know, I need to, in some ways, lift myself. We also have examples in the movies, shows, or even in our own personal lives, that when we're feeling stressed after a long day, when the kids are getting on your nerves, or you just need an escape, you may come home and have a drink to relax, to escape, or to avoid certain things. And there is absolutely no judgment from me when it comes to that. Now, some people can do that and it never affects their jobs, their relationships, their livelihood, etc. But for some people, it absolutely does affect those things. And using substances to cope with life's difficulties is a form of what we call self-medication. I need a lift, I need to feel better, so I smoke a blunt. I can't sleep, I'm having a hard time calming down, so I have a glass of wine or I drink a little bit of liquor. And it makes sense because most people tend to repeat what we believe has been working for us. A process of learning takes place in the brain when we continue to respond to situations over and over again in a similar way. The problem with this is if you or someone you know is experiencing something like anxiety and we're self-medicating it with the use of substances, it has actually been shown in some cases to make your anxiety worse. So what do we do when we want to start to experience anxiety again? We smoke a little bit more. We know that alcohol is a depressant, but if you have symptoms of depression already and you're drinking to avoid those symptoms or to drown them out in some type of way, that can make your depression worse. And again, the brain pushes us to do what it's learned to do in the past. So when we feel bad, we drink some more, creating this cycle that for some people it becomes really hard to get out of. On the flip side, we also have some people that may have never had any symptoms of depression or anxiety, but they were just using substances for some other reasons. Most people use for 2 social reasons and 2 individual reasons, right? The 2 social reasons include things like bonding, conformity. The 2 individual reasons include things like enhancement and coping, right? Now, if we begin using substances over time, we start to experience things, sometimes like anxiety and depression, naturally, and people want to ward those symptoms off with continued usage. But we can only keep those symptoms under control for a temporary period of time. Now, what can we do about all of this? I often tell people, if you can't change the symptoms of things like depression and anxiety, let's consider maybe changing the way that we respond to depression and anxiety. In other words, let's start addressing these things like depression and anxiety, in a healthier way. For some people, they use things like medication, maybe therapy, and those healthier options. I don't suggest anyone using medication alone to address mental health and substance use disorder, because we know that medication is only built for you to get halfway, and then once you've gotten that lift that you needed to do the things, once you don't feel as depressed anymore or you don't feel as anxious anymore, we can start to use the tools that we've learned from our counselor, from our therapist. But also, when you think about going to therapy alone, that has been shown to be really useful for a large number of people. For people with anxiety or maybe a milder form of depression, there's cognitive behavioral techniques that people have found to be so useful. When I say that, I mean gaining a better understanding of how my thoughts and my perceptions of the world around me tend to make me feel some type of way. Because I know that just because my thoughts are mine doesn't actually mean that they're right? But the way that I feel also means that I'm going to respond or react in a particular way. My understanding, though, and awareness of that gives me the opportunity to slow down my process enough to either get my thoughts in check or to respond to my behaviors in a completely different way. Now, when you think about this, one of the things that I always tell people to step back and do is also take an inventory of your life. What's going on? Are there people in my life that's creating anxiety? Are there things in my life that's creating a sense of depression? And if that's the case, we really want to take some time to think about, are those things in some ways able to be removed? This is your opportunity to live life completely differently than you've lived it before. This is your opportunity to become completely self-aware, to look at and examine your circumstance and situation currently so that you can do something different. Now, everybody watching this video right now, I know, has a purpose. Everybody watching this video right now also has a sense of self-worth. And if you don't, this is the time where you can start to encourage yourself. This is the time where you can start to do something different because you have choices now, right? And so I'm going to encourage you, think through the things that you used to do, the things that you used to enjoy before substance use was even an option. Think through, is there a possibility that I can still engage in some of these things and they be helpful for me if the substance of my choice is not available? And if that's the case, start to utilize your healthier coping skills, the things that you know are not going to put your freedom in jeopardy, because depending on the substance, it could potentially do that. The things that are not going to put your health at risk, right? Because you are worth staying alive a lot longer for your kids, for your family, for your purpose, right? For the things that people can only get from you, you have to be alive and available to be able to do those things. And sometimes using substances, unfortunately, can get in the way of that. And so I'm going to encourage you today to do a little bit of homework. Start today with thinking about, what things have I been doing prior to substance use that I really enjoyed? What used to help me calm down? What used to help me to lift my spirits? And start practicing that stuff today. That's the first step that you can take that doesn't cost a whole lot of money in most cases. That's the first step that we can take if we don't feel comfortable going and talking to a counselor just yet. But the whole point is that we want to move in the direction where we can start to really seek some type of care that's beneficial and that's not reliant on something like substance use. Thank you so much for listening. We're going to talk more about this topic and get a little bit deeper as time goes on. Again, if you have any questions, if you want to drop any comments that will be helpful in helping me to think through how we're going to get into our next topic or topics to come, please drop that stuff in the comment section. All right. Don't forget to like, share, subscribe to this page, and I want to make sure that you don't miss any of the information that's going to be coming next. All right. Thank you so much. I'll talk to you soon.